So greetings, my name is Dr. Kathleen Anderson and I'm an equine practitioner at the Fairhill Training Center in Elkton, Maryland. My assignment today is to provide a brief introduction to the METS Euthanasia Roundtable geared to providing facts and conversation about the subject of equine euthanasia. The Maryland Equine Transition Service, METS, is a statewide equine safety net initiative of the Maryland Horse Council that provides safe alternatives for horses in transition. Sometimes this includes the decision to humanely euthanize horses that have significant health or behavioral issues. The end of life is inevitable for all, man and beast, but it is not a subject that comes up very often for discussion, except under duress. The word euthanasia comes from the Greek two words, eu, meaning goodly or well, and thanatos, meaning death. So euthanasia is literally the good death. The following is a discussion by METS panelists on euthanasia of horses to bring transparency and informed decision-making to you, the horse owners. The METS panelists include equine practitioners, Drs. Justin Sobota, Peter Radu, Elizabeth Callahan, and small animal practitioner, Dr. Mary Gardner. The roundtable kicks off with a clinical discussion introduced by Dr. Sobota on the procedure or logistics of euthanasia, the science of euthanasia, if you will, which is comprised of a preliminary conversation for the horse's connections and the veterinarian. This is a critical preparation. When to say goodbye, before or after. Procedure options, to sedate or not, to anesthetize or not. What are the euthanasia methods available? What are the pros and cons? Safety is an imperative consideration for all, owners, handlers, and veterinarians. Location does matter to facilitate a safe ending for elective euthanasia. Options for disposal of body. METS lists resources, but this discussion also underscores the need for pre-planning in order to have a smooth transition. How to preserve memories. Dr. Callahan offers a keepsake kit to her clients with information on available options such as horsehair pots or lockets. The roundtable then shifts from the practical to the philosophic and personal. How do vets cope with the loss process? All veterinary panelists agreed with the premise that veterinary medicine provides a gift to relieve animal suffering no matter what the cause. The end goal is death with dignity. Grieving for horse owners is not commonly addressed. This will be unique to each person, but it is definitely a consideration to be aware of, and we hope that this conversation will open the door to asking for help if you are struggling with the grieving process. Dr. Gardner succinctly states that although we may not control the why or the cause of euthanasia, we can control the how, which underscores the need for this discussion and planning both the euthanasia and the grieving. Decision-making becomes the crux of the matter. When is it time? Education on quality of life scales will be specific to age and use of the horse, but primarily focused on eating, movement, drinking, and body condition or weight. Decision-making is personal. However, the panelists agree that there is often an underlying societal taboo on elective euthanasia, which can create angst for deciding, is it time now? Additionally, increased legal and moral obligations on abuse or chronic suffering cases are certainly forcing some much-needed accountability for all parties. Catastrophic cases are the easiest to move forwards with. A lack of rehoming options is likely maybe the most difficult scenario for those with a healthy but unwanted horse. For example, the aged healthy horse whose family is no longer able to care for it. Speakers point out how important it is to remember that euthanasia beats some other options, such as the unknown outcomes of the public sales ring or the serial adoptions. How to prepare emotionally for the finality of loss. It is okay to express emotions. It's good to be present if you are able. Death is a process. Horse ownership has seen a shift from livestock-based practice to a companion-based approach, and the METS panel discussion is invaluable to bridge the gap at the end-of-life transition for horses and their humans. I'm sure everyone will take home several useful thoughts to consider. So without further ado, please sit back and enjoy the conversation. Thank you.
Sure. I go over the right questions. You were talking about medical steps, right? You want to go over medical steps?
Yeah, so, okay, we are recording. So, okay, let's get right into it so that we make the most of our time. So we want to talk about equine euthanasia and what happens in a regular medical euthanasia. What are the medications used? What can owners expect when a vet comes to their farm to perform an equine euthanasia? Dr. Sobota.
Super. Good morning. I wanted to start just with the fact that there are AAEP guidelines for euthanasia. I think that's a first step that we need to talk about quickly in order to understand some of the general aspects of euthanasia when it comes to horses. Certainly, there are a handful. One would be a lethal dose of a barbiturate. Second is gunshot to the brain. Third is a penetrating captive bolt. Fourth would be a lidocaine, 2% intrathecal, which can be done under surgical plane of anesthesia. And then you can also use a concentrated potassium chloride or a mag sulfate IV also under surgical plane of anesthesia. So those are more common ways or acceptable ways by AAP that we should all have a certain groundwork and an understanding of. Certainly there are other alternatives in special circumstances that as a veterinarian we may need to implore, but those are the general guidelines for euthanasia according to AAP. Now, a lethal dose of pentobarbital sodium, a barbiturate, is typically the form of euthanasia that we provide as veterinarians. With or without sedation sometimes is up to the veterinarian, of course, in my opinion, in the sense of maybe the anxiety of the animal. And so if there is a level of anxiety that we feel that we need to provide some sedation, we'll do that. Then certainly we may or may not actually then put in a catheter. We'll put a little local anesthetic in the jugular vein and then put a catheter in depending on the anxiety of the animal as well, and then perform the overdose of barbiturate, the pentobarbital sodium. So those are some things to consider. I know some people think about a general plan of anesthesia even before the pentobarbital, and I think that's something that we could always discuss and think about and talk about. But that's a general idea of how euthanasia is completed out in the field or at the clinic. And I know we had some really good questions that were provided, and we're just trying to go down some of the groundwork here. In general, euthanasia for horses is fairly speedy. It can take several minutes, as it is an overdose of medication that initially stops the heart, really. Sometimes, in my opinion, the discussion and the explanation of euthanasia with the owner, and of course getting to that point, is what takes the most amount of time. And so we need to understand that and have a good bedside manner and trying to have our client or the patient owner, etc., companion owner, understand these things. And so for me, it takes a lot more time for explanation and certainly to be a part of the process, which is a very valuable process. And so that takes more time. But in general, right, the actual aspect of euthanasia doesn't take a ton of time. After the euthanasia, of course, we're always going to check for heart rate. We're always going to check for corneal reflex. And these are important things that we want to think about as well when we're euthanizing horse before we step away as veterinarians. Another good question I saw, and just to try to bring some general basis to what we're doing here this morning. There was a question about reactions of providing a barbiturate, and so yeah, there are certain reactions or a timeline of euthanasia, if you will, during those several minutes. I think one of the biggest things that we think about when euthanizing is, as a veterinarian, keeping everyone safe, right? And so sometimes it is hard to control a large animal from going left or right or backwards, and sometimes it may be difficult to do that. And I think people have to be somewhat prepared for that. It's certainly not a non-dramatic, right? It can be somewhat dramatic experience, even though you may do everything correctly and try to create the best environment and situation for the owner and the horse. It can be somewhat dramatic, and so we always have to be aware of that.
Is there a pro or con to using or not using a sedative before the barbiturate dose?
Well, in my experience, and certainly I'd like to hear from Dr. Radu as well, and certainly if there's an anxiety level of the horse, right? If this horse is quite anxious, then yes, I'll typically provide sedation to try to lower the heart rate a little bit, get that under control, because if you're injecting a large amount of barbiturate, I want to make sure I do it correctly. And so I'll sometimes want to sedate them just a little bit, but that can, there's some cons to that as well. If you over sedate them, certainly it can take potentially a longer time for that barbiturate to get into the system, and may take a little longer for the actual euthanasia process to happen. So there's that thought as well.
One of the biggest downside I've seen is with neurologic horses that are being euthanized, that giving them a sedative will cause them to decompensate and often be much more unsteady on their feet.
I agree with Dr. Radu. I think that it endangers the handlers and the veterinarian if you have a horse that's already unsteady in its feet and you tranquilize it. It can be quite dangerous to try and work around that horse.
Yeah, you mentioned controlling a 1,000-pound horse. Sometimes I've had experience with difficulty in controlling a distraught owner. And having them want to hug the horse goodbye before it's gone, or before it goes down, and putting themselves in substantial risk. So I try to be clear about rules about letting me take lead shank when the drug has been administered, and taking 10 big steps backwards.
Yeah, Dr. Radu, I think that's a really good point. I will typically have maybe an assistant with me, and I may have my assistant sometimes handle the horse in that situation, because I certainly don't want fingers to get caught in lead shank, as you're suggesting, or the halter, et cetera. And having that assistant, they know what I'm doing sometimes rather than the owner themselves sometimes. I think that can be safer for the situation sometimes. So I like your point there.
And I agree with you. I always take the lead shank if I don't have an assistant, because I don't want someone losing a finger or a hand during that period of time, and they certainly can. Plus, a lot of people don't realize how quickly the horses go down, and if the horses go down forward, they'll trample the person in front of them. So I'm always the one to take the lead shank as well.
I think that's a really good point. I think that that's maybe something that many people don't understand, because we want to be there for our horses in those final moments, but we have to keep the humans as safe as possible. So I think that's a really interesting, good point to bring up that maybe a lot of people aren't aware of. As you mentioned at the beginning, Dr. Sobota, there are other methods approved by the AAEP. In this region, medical barbiturate euthanasia is more preferred. I think in other parts of the country, gunshot euthanasia might be the more go-to method. Any insight as to why that is the case? Why is gunshot euthanasia not as accepted here, do you think? Is it based solely on the the impact that it can have on the humans. You know, hearing a gunshot, I think, is a little bit more traumatic than watching an injection. Do you think that has anything to do with it, or do you think it's a more medical basis?
I think it's a demographic basis, that this is just a different demographic than we're going to see ranching people, people that have cattle, people that have treat the animals more as livestock. I think it's a much more acceptable reason. I just think that this is just a different demographic than other areas of the country, and you know, that's what's preferred here. I'm not sure how the other doctors feel, but
yeah, I have never actually done one, but I believe a gunshot properly done is equally humane.
You're right. I think certainly demographics are a big part of it. Certainly much more accepted in the Western ranching community where horses are considered livestock. Legally they're considered livestock, but certainly emotionally they may be more considered livestock in a different ranching environment than say here in Maryland.
So we had a number of questions about alternative medical ways. I mean, the most commonly used is the barbiturates, but there's been a lot more chatter recently about composting those animals and burying those animals, and the effects that it has on the environment and scavenging animals if the horse wasn't buried deep enough and they were to dig it up. Dr. Radu, you've used alternative methods before,
I've done a total of 2 horses with potassium salts, and it went quite well. It's there was a little bit of involuntary movement as it was being given. I have no qualms about the humaneness of it. It's noticeably more time consuming to get organized to do it. It's dissolving. I worked it out to be the typical container of light salt in a 5-liter bag of fluids, and getting that dissolved and ready to go. You know, if you have an urgent euthanasia with a fracture or something like that, it's awfully easy to just fall back on what's you've done many times in the past successfully.
I have used the intrathecal lidocaine, and I felt after general anesthesia, and I felt it went very well. I did feel a little bit more involuntary movement. It took a little bit longer for the heart to stop. I am sure the animal was completely anesthetized, and I felt it was very humane and certainly a practical alternative as far as volume and preparation. Most of us have lidocaine on our trucks, and also methods to put an animal under a short-term general anesthetic. So I felt my issue would be, again, with a neurological horse that I'm trying to introduce anesthesia with, it certainly could be a little bit problematic, but I felt it worked very well.
Hey, Dr. Mary Gardner, this is Justin. What other forms of euthanasia do you guys provide in the small animal?
This has been very interesting, and I've been dying to ask some questions. But like you, most of ours is with barbiturate, and it's really mostly the route that we give it. And every pet that I euthanize, I fully anesthetize them, and that way they're laying down, they're sleeping. The owners can snuggle up on them and love on them. I kind of actually, when I lecture to veterinarians, I say, for those of you that don't want to sedate, again, totally okay. Nothing wrong with that. And in the UK, the majority actually don't sedate first in small animal. But I say without it, it kind of reminds me of an equine euthanasia, where it's very sudden and the pet is standing maybe and they just, collapse. And I remember that in vet school, that sudden death of a pet or of a horse, and it just startled me a little bit. And I think for owners, it could startle them where, if it's their house cat and dog that is, sleeping in their bed, and it's their family member to have that. And so I think it provides a really nice gradient of within the process. So it's sleeping. Oftentimes they'll say, wow, this is the most, best sleep that they've seen them have. They've been anxious also, they've been painful. And so to see that is really nice for the owners. And then that allows me to go any route I want. So it's really the route for us. And everyone's go-to is a saphenous vein, let's say. Usually in clinics, they all want indwelling catheters. I go to homes and I just do a butterfly catheter. And of course, our dosing is way smaller and than a horse. But if I need to, and very often I do just by default, I'll go intrahepatic because it's nice. I just give it. It takes about 10 minutes or so for the pet to pass, and I could step back and let them still be with their pet without, you know, this abrupt passing. But a lot of times their vessels are challenging, and their, you know, legs are all edematous and their abdomens are swollen, and so I'm very much comfortable and very prepared to do intrahepatic, intrarenal, and cats all day long. I remember speaking with some equine vets, and they're like, "Oh, intrarenal, because these barn cats, you guys, it was hard for them to find a vein in a barn cat." So, so I'm like, "Oh, try the intrarenal method. You'll never want to do anything else." And even intracardiac, it's just how you explain it. It's what's most important. And so that's the majority. And you know, it is interesting in the different demographics, even in the pet space. Here in South Florida, gunshot would never be considered. I also lived in Oregon for a year, and every one of the farmers thought what I did was insane. They're like, "We just shoot our dogs. I don't understand this." So it's use, it's connection, it's whatever. But I think all small animal veterinarians should be ready and equipped to do all the routes, because it's not always easy to get a vein, and we have to be adaptable. And now my question to you guys is there a way though to sedate and like anesthetize a horse so they are lying down safely before you give the second medication? Or is that not possible? Not normally possible?
So, Dr. Gardner, to your point, when I euthanize a horse, I always talk to those. I'm in mixed animal practice, so I also work on dogs and cats. So I will tell them this is not going to be like your dog and cat, that the horse is going to fall. It's not going to be as peaceful or as pleasant as, you know, your dog or cat euthanasia, simply because of the size of the horse. And to answer your question, yes, we can anesthetize them. They still fall down, and they still fall down hard. So it's not like they just gently bend their knees and lie down. I mean, they fall the same way, whether you anesthetize them or not. So you still have that sudden, you know, and I think that's the hardest thing for the owners, is that sudden from standing to down with, you know, and sometimes these horses are in poor shape. They'll fracture their pelvis or something going down, and no, they don't feel it, but you can hear it, you know. And I think sometimes it's very difficult for owners. And I always warn them that it is not going to be like their dog or cat that they've had put to sleep.
Yeah. No, I give you guys much credit, because it is a much more physically and emotionally challenging euthanasia, I think.
My standard line to people is that once they start to collapse, they're already unconscious, and if they hit the ground hard, they don't feel it.
Let's kind of go off what Dr. Gardner just mentioned. How do you, as vets, all four of you, how do you handle the emotional aspect? Whether it's an animal that you've been treating for years in your practice, or maybe you've been called out for an emergent case. What are the things that you do to protect yourselves from, because every single one has to be traumatic to you on some level. So what are some ways that you are able to handle with this kind of darker side of your practice?
For me, I feel that euthanasia is a gift that is not allowed to most people, and that I am upholding my veterinarian's oath to relieve suffering. And it may be difficult, but if I euthanize an animal for whatever reason, whether it be mental suffering or physical suffering, that's a gift that a physician is not allowed to have. And I appreciate and see each one as a gift to that animal. That's just my way of thinking, but that's how I deal with it, that I'm able to do something for this animal to help it.
Yeah, I certainly look at it as a relief of suffering, right? And if I'm euthanizing the animal 95% of the time, it's for good reason. And whether that's founder or colic or an emergency of some sort that we can't remedy. So I feel blessed to be able to do it, and that makes me feel good about the procedure.
Yeah, there's a certain need to accept the inevitable, but our basic job is to fix things and make things better, and a lot of euthanasias go along with feelings of failure and not having done everything that you could, even though you did. So I think it's emotionally wrenching, and that's an aspect to it. And then there's also the aspect of empathizing with clients who are often your friends with their loss. There are some that are definitely easier than others. The flopping leg is a no-brainer, but there are some that are definitely wrenching, and I confess I've shed a few tears in the process of doing them.
If I may, I definitely cry also. I cry a lot, even if it's the first time that I've met them. And often with our organization, we exclusively do end-of-life care. So we're going to the homes, and we will typically do about 60 appointments a month, which is high volume for any veterinarian to do. So, and a lot of people ask us, are you emotionally tapped? Are you, compassion fatigued and things like that? And I always say, heck no, we're not compassion fatigued. We have compassion. That's why we're doing this. Sadly, about 50% of pets that are small animal pets that are euthanized in clinics have not been to their general doctor in over a year. And when I go to homes, and that's the same thing in the home, these pets have not been to their veterinarian, at least 50%. I struggle with that. Like that, I'm like, what we could have made this last year better. We might not have extended the length, but we could have gotten the quality better. That's what bothers me. And so my priority in as a veterinarian now is educating vets on geriatrics and what we could do for our geriatric pets. But I always say I may not be able to control why I'm doing this euthanasia, right? Like if it's a cat with diabetes and the owners can't afford insulin, and I could, but I can't take any more cat, doesn't matter. Like I'm still going to do this. So I may not be able to control why, but I can control how. And I can control how I describe everything to the pet or to the owner. I can control, how I help them assess quality of life. I can control the process and making sure that they, in our world are sedated, are really, very peaceful and relaxed, that the owner's got, the emotional support they need and do it well. And when I leave, even something as small as I, as a veterinarian, will do every single paw impression in clay in front of the owner. I want to do it right then and there, so they have something at that moment to take with them. And I believe even horse lovers would love something then, a clipping of mane and things like that. And it takes their mind away from grief to a little smile sometimes. And if I can get that, and if I can, without a pandemic, get a hug, it helps me. And so I'm very satisfied that I can provide such an amazing goodbye. And to everybody's point, it is a gift that we have in veterinary medicine. It doesn't make it any easier for the owner. I just euthanized my own dog last Sunday, and it's horrible. I medically rocked that euthanasia. Like it was the best one ever, but emotionally still was hard. But it helps me to know that she went perfectly at home. And I think with a lot of you are connected maybe even more to your owners than we are in small animal, because you go to their farms, you go to their homes, you're talking to them maybe more in the middle of the night, and you might have a different connection. And so I think it's a wonderful connection to have with our families. And to your point, I think it's okay to cry too, and be a part of that. I know a lot of new vets ask me, oh, is it unprofessional to cry? And I always say, a lack of empathy is as vulgar as an excess of tears. So So to show some is okay. Just don't outdo the owner.
To your point, Dr. Gardner, we have a little bag, little net bag that we cut hair, and we also have some information on there where they can get horsehair memorials. And so we'll cut some of the horsehair tail, put it in there, and leave the bag with them, and they can decide later if they want to, send that. They have the information right there on a little piece of paper, and I think it helps, because some people, you ask them and they don't know at that time that they want that, but here it is. It's done, tastefully, and I think people have appreciated that.
For sure.
There was an amusing cartoon of a bunch of horses in heaven all looking at each other, wondering why they were all missing a piece of their tail.
Oh, I'm going to need to have that. I love it.
It's the shorter your tail, the more you were loved, or something like that. I think that's
oh, I got goosebumps. I love that.
Yeah, those are really great points. And I think it is something, like you guys said, like in the human world, doctors aren't able to help people pass with dignity like we're able to help our animals do. And it is such a beautiful thing to be able to do that. Dr. Gardner, I'm sorry you had to put your dog down.
It's hard.
It is.
As you guys were mentioning, the floppy leg, which I'm assuming is a mobility issue. We don't have that in dogs, but it is also sometimes different depending on the disease that the pet has. So if you've got one where they're not eating and they're sick and feeling cruddy, sometimes, or in heart failure for me is or anything with respiratory distress to me is like, I want to do this faster, like sooner than later. And sometimes owners are better with that because they see the pet really sick. Mobility is a hard one, and that was for me. My girl had spinal lymphoma, and it was her mobility that was her issue, and she was just happy and fine except for her floppy legs.
Yeah.
and it was tough.
We actually, off that, we had a couple questions. Let me pull one of our questions. So here's a specific one from somebody named Joni. Talking about how you know when it's time to euthanize your equine. And I think a lot of these are also probably applicable in the small animal world, Dr. Gardner. But Joni says, if day-to-day life activities are difficult or painful, I would say quality of life had reached a point where euthanasia is in order. However, what about for a horse that is fine some days but in pain other days? How can you measure that enough is enough when the majority of days are fine and the horse is thriving, eating well, and apparently enjoying life? For background, I'm asking about a horse with head shaking syndrome, which causes nerve pain in the face. Currently, it's controlled with gabapentin, but gabapentin becomes less effective over time. I am exploring other medication options as well. So in a case like that, how can an owner know when it's time to euthanize and to stop that suffering when it's just a day here, a day there? Dr. Callahan, how would you answer that?
Well, I think that, horses like to do certain things. They like to eat, they like to sleep, they like to walk around. And when those qualities that they can't do that, and the majority of the time, I would not say that 1 day or 2 days of head shaking is going to interfere with that horse eating, walking, or, sleeping. But when it gets to the point where those basic physical activities are impacted, it can't eat, it can't maintain weight, it can't walk around because it's got chronic laminitis, it's in pain all the time. I think that's where I would say, when it's interfering with those basic life activities, that would be time to start considering whether A, in her case, are there other options? And yes, there may be for head shaking, or B, is it time for euthanasia? And I'm not sure how everybody else feels about that.
I would basically agree with that. I think sometimes clients are overly concerned in eliminating absolutely any suffering. And I think in chronic situations, the horses will tell you when enough is enough, when they stop interacting with you and with their owners and other horses and stop eating. Those are the big signs.
Well, I thought about this question quite a bit, and a few years ago, I tried to create a little bit of a quality of life scale, and some of that I found from Dr. Mary Gardner, and then tried to apply it a little bit to the horse. And I know METS and Katy Whipple have also helped to adjust that a bit as well, because it's always a constant evolution of quality of life. And certainly, I think Dr. Radu said something in respect to certain people may have a different feeling about what quality of life is. And so numerically putting a number on this sometimes is difficult, but a lot of this information I think has come from the human side as well, where they have some scales. I'm sure Dr. Gardner has some thoughts on that, but we try to apply it right to the horse. And certainly I look at the horse and I think mobility is probably the most important thing, certainly in a dog or cat. Maybe a dog, you can put them in a wheelchair or some sort of mobile device, right? Where we can't do that in a horse at all. And so for me, mobility is really, really important, followed by some of those other important physical activities of nutrition or eating or hydration and elimination, and certainly herd behavior, attitude, and just simply looking at heart rate and whether or not you have to give medications, and all of these things kind of combined together help me give a little bit of quality of life. And I've given out quality of life scales that I've prepared, if you will, to clients to try to help them gauge maybe a little bit about the number of good days versus bad days, and try to put a little bit of a numerical value on it. As a veterinarian, I like numerics, if you will, but we still have to also understand what the heart says a bit and try to incorporate that into our quality of life discussion.
Oh boy, is it too? Oh.
No, go ahead.
I have a hard time because this is my like favorite topic of all. So, and it is really not very different in the small animal space. And I think I was like writing some notes because I could talk for an hour on quality of life. This is our #1 question. I think every animal hospital, small to large, should have information on their website about assessing quality of life, because it is the #1 trafficked page on our website, because people want to know, and there'll be somebody flippantly in their life just saying, "Don't worry, you'll know," and sometimes you do. And I think in horses there's some magic that with them, but sometimes if you're waiting for a look and you're waiting to know for sure, you are waiting for active suffering to be present. And there is a wonderful place called Denial Island that many of us are residents of during this time, and you may not see it. So I love scales, and to Dr. Sobota, your point, like sometimes numerics is weird about this, but you could soften it, right? And so it's just a guide to help you. And I always say, I wanted to make a joys of living list. Like, what makes this horse this horse? Every horse, every dog, every cat has a different personality, right? And what makes Rusty Rusty? And when they're not doing those things, then it's definitely a certain quality of life issue. You know, eating and mobility is massive for any animal. The bigger the worse it is, right? I had a harness for my girl. I'm not going to harness a horse. So that's a massive issue. But something I love to do is with those quality of life scales is not just say more good days than bad. It's what is the percentage? Is it 30% good, or is it 70% good that you want? It's not just 50-50 sometimes, right? So to your point, you know, Dr. Callahan, like 1 or 2 head shaking days is not so bad, or, you know, but 50% or more, that maybe that's it. And also, what is a good day and what is a bad day? And actually define and put words behind that. Is, you know, are they not eating all of their food, like whatever it may be. You know, I'm trying to use obviously examples for the equine space, but for us is, you know, do they sleep through the whole night, or 4 hours is good, right? Like, you know, did they have one accident in the house, or is there, you know, pee all over and you know, feces all over? Not good. So you have to define what is good or bad, because everyone in the household, everyone in the farm may have different belief systems on what is good or bad. And that helps families come together, especially when there's husband and wives or partners or whatever, and they have to make a decision together. And one thing that is really important to consider with quality of life is also caregiver fatigue and caregiver quality of life. And that could be massive. You don't know what's going on in their own lives. You don't know all the issues that they've got to deal with. For me, I wasn't sleeping for months, not sleeping through the night, sleeping on a couch next to my girl, waking up early to make sure, she was clean and good and, moving. And so it's a lot caring for a terminal or geriatric pet. So for me, anytime I have a terminal illness or a very old geriatric pet, I say, you are in a subjective time period, also known as the roller coaster. And you're going to have good days, bad days, hills. You're going to be ready to pull the cord and get off at any time. At any time when you're in my subjective time period, which starts today, with this conversation, I support your decision to say goodbye at any time and not let them feel bad if they want to keep going a little bit. Now there is going to come a time where I'm going to talk you off this ledge because we need to help this pet. But until then, I'm going to support your decision, make sure palliation is important. And I think that's good for all size creatures.
Absolutely. I think that brings us really nicely into another question from Janet, kind of thinking about your point. Sometimes owners are going to be on that denial island. But Janet asks, is it ever a veterinarian's place to suggest to the owner that it's time to let go? I'm not thinking of catastrophic injury or inoperable conditions, more of a horse whose quality of life is poor or surgery with a low chance of success.
And I will answer yes, that I have told owners that I felt that that they need to consider euthanasia. Again, my oath was to prevent animal suffering. And if I feel that an animal is suffering, I don't make that decision, but I will tell them that I feel that for this X and X reasons, that I feel that they should consider euthanasia.
No, I certainly recommended euthanasia, if you will, in the sense of quality of life or understanding the circumstance. And certainly owners want our professional opinion, I think, oftentimes. So certainly some do not, but a lot of times I think they want a professional opinion. We've seen this multiple times. Where is this leading? How is this going? And certainly understanding our diagnostics and our veterinary skills, trying to utilize those to ultimately decide, the outcome is poor. People want to know that before it gets to that very poor situation.
I'll let Dr. do.
Yeah, no, I have in instances recommended it, probably not all that often. I have a very conscientious clientele that are more likely to bring it up to me without prompting. T can speak to this as well. There is a newly changed regulation in the laws regulating veterinarians that states that it's a punishable violation to allow abuse to continue without intervening or reporting it if it comes to that. So we have a legal as well as moral obligation to do something.
So that means that if you recommend euthanasia and the owner does nothing, you're obligated to report to animal control? Is that what that regulation means?
Yes, I would say that individual circumstances might modify that, but yes, if push came to shove, I think that's what it means.
I think what Dr. would do, if we see an animal that is suffering or in intractable pain, that the owner does not, if we consider it abuse to the point where that horse is suffering and the owner will not make steps to treat that condition, or the condition can't be treated, then we do have a legal responsibility to report that to animal control. So, and and that's very rare. It's not that if I consider euthanasia or I tell the owner I think they should euthanize and I'm going to report them to animal control, but if I see an animal that's actively suffering and I consider it abuse, that's starving to death because it isn't being fed or has chronic laminitis and can't walk or bear weight on one leg, I have an obligation to report that. So it's not that any animal that I feel that that the owner should consider euthanasia, I'm going to report. But if I see an animal that I feel is abuse, it's an abuse situation, I can report it.
Yeah, I think like Dr. we get most people asking for it, obviously, but I do think sometimes it's very helpful to bring it up with owners. They don't want to mention this word. They don't want to do this. They, and just, gently and compassionately, also confidently though, bringing this up as an option. Sometimes they feel like they're a failure if they, they don't want to tell you because you've been working so long with them and hard on something. And I think it's really helpful to have this kind, compassionate conversation with them. Let them know that you support their, support them either way until it gets to be the, like what you guys were saying with you. But, we have the benefit of a lot of sedation and pain management because they can just be, a little cat can be curled up in a sunbeam and I could highly, medicate them like we do in humans. That is hospice, end of life hospice with humans is massive drugs, which you can't do with horses necessarily, right? Because they have to be mobile. But anyway, back to the point that I absolutely will bring it up if I think it is an option. And most families are fine. Once in a while, we'll get the person like, how dare you bring this up? But it is my oath. Here's a good saying I usually say, I know you don't want Rusty to suffer. He's struggling though, really hard. And if we let him go, he'll never suffer. And owners like they kind of like that because then they realize that, letting them go, I always say, a week too soon than a day too late, those sayings, which are very helpful. But right, if we don't, nobody wants suffering. And so that's why if you're on the fence and we don't know, and I like to bring up and say, he's struggling though right now, and I don't want him to ever suffer. And wouldn't you agree? And saying things like that, wouldn't you agree? And, to get them over the line is all really helpful.
That it's important. We bring it up at every assessment we go to. We talk to owners about euthanasia, even if the horse is down and, obviously not a candidate. We talk about it, if for nothing else, to make it the word euthanasia, which is kind of a little taboo, to make it more of a part of the conversation. If it's not a part of the conversation, then it remains something that's difficult to talk about. And when the time comes, then we do end up being a day too late with the euthanasia and the animal is suffering needlessly. Whereas if it becomes more of a part of the regular conversation, then maybe the public at large will be better at recognizing those signs a week early and is better prepared to deal with it.
An observation on the quality of life issue. I think horse owners are often guilty of overestimating how much the horse values their interaction. The storyline is my horse loves to work, and if he can't, go to a horse show every weekend, he's not going to be happy, sort of thing. And those horses would be perfectly happy out in a grassy paddock, not being bugged for the rest of their life.
Right. Listen, I'm happy not doing all the things I did when I was 20. Right. Like it's okay. We don't have to be the stallions for our lifetime.
I do think one of the things, though, that we haven't discussed that we see more in horses is the economic aspect of horse care and euthanasia.
Oh, yeah.
Because, that owner cannot find a home or a suitable home for that horse that's got some type of debilitating disease, and, that they're expensive to keep. And I think that that's a little difficult. I personally would much rather euthanize a horse and see it go to an unknown fate in an auction house or a slaughterhouse or something like that. And that's very difficult for people. I feel a lot of people don't want to euthanize their animals. They'll send it off and think it's going to get a good home. And this is why METS was formed, really, because there's a lot of time there's no good home at the end of that.
Yeah,
That's literally the line I use is we would rather this beautiful, healthy animal be humanely euthanized than potentially end up in the auction pipeline, where its fate is unknown and probably going to be really awful. That's literally the line we use. So what are some things that we can do to help people understand that? You know, I can talk about it all day long. We can talk about it all day long. How do we get it to be more accepted that that is a preferable outcome for a horse who is rideable or a healthy horse where we can find an appropriate home for them?
I tell people that there are things that are worse than death, and that would be one of them. And that, you know, if I put your horse to sleep that we can't find a home for or whatever, that you at least you know it went peacefully and quietly and in a familiar surroundings. But I have seen some of these horses. I have seen horses in places that are worse than death, and I firmly believe that. Like just like Dr. Gardner was saying, better a week too early than a day too late. And I think that that's going to be a societal taboo. We've taught that, you know, life is precious and that all, you know, that we should be maintaining that. And I think that that's going to be, I don't know if you'll ever in this particular society, and I'm talking about, you know, North American society or whatever. I'm not necessarily religious, but it's very difficult for people to have that time. And I don't know whether any of us in our lifetime will be able to convince people of that. It's our belief system. I think it's a Christian belief system, and I think it would be very difficult, but I firmly believe it.
One of the other things that we talk about with our owners is controlling the fate. You know, you can control the fate of your animal while it's in your care. Once it's off your farm, you don't have any control over that fate anymore. So that's just one of the things that we talk to people about.
I don't know about this auction world. I'm going to have to look into this because now this is sad. It breaks my heart to know this. You know, what's interesting though, is even in our field, sometimes veterinarians are anti-euthanizing some pets. And I've run across that in many of my lectures, and I'll talk about a healthy 12-year-old golden, you know, that's just been diagnosed with lymphoma and showing no signs. And I say, I will euthanize them. And I've gotten negative feedback from veterinarians that are like, how dare you, the pet is okay. And I said, my oath is to prevent suffering from happening. And if I do it sooner than later, then not saying I would do it. My girl Sam, she was like, I had radiation, I did chemo, I did everything. It's not saying what I would do, but I would also help an owner that can't financially care for their pet. I always say there are 4 budgets to caring for an animal. Monetary is one, and that is big, especially with the larger the animal. I mean, Sam was expensive and she was a big girl. There's the physical budget, the time budget is massive, and the emotional budget. And if any of them are up, I support the decision to say goodbye, because where else are they going to go unless you know for sure that you're finding a good home? And this, you know, happens a lot with aggressive animals for us. And, you know, and mental illness is still an illness, but I think it's taboo a little bit also within the veterinary space. And I think it's just a good topic to bring up and be non-judgmental to the families and to the veterinarians that perform it. But I've gotten beat up a little bit, and that's when I say, well, did you have a steak for dinner? Because you must euthanize healthy animals to eat them, and we're okay with that, but we're not okay taking an animal that will be suffering soon in some manner and not doing it well. So I can get on a soapbox on that one. So I'll step down.
My personal checklist when I find myself tending towards being judgmental about people euthanizing for financial issues is, you know, whether I would adopt the horse and take care of him for the next 10 years.
Right.
And usually the answer is no.
Correct.
And
you guys got longer too.
Yeah.
We don't have like 20, 30 years.
No, we got 40, 30, 40.
And big. And big. That's a great one, Dr. Regan.
Yeah, that's a really good way of looking at it, Dr. Radu. I have a really good question from a local rescue. This is from Lori. We're talking about this transitioning into disposal options. Dr. Sobota, I know you've been working on this a bit too. Lori's question is, as president of a Maryland horse rescue, I am periodically faced with equine euthanasia decisions for our residents, as well as presented with questions from volunteers and local horse owners about options for cremation, burial, and especially humane and respectful options available for disposal and removal of the horse's body. There's a small list of available companies. I'm sure everyone on here is well aware that our options in Maryland are limited. Is there a comprehensive list of all the information, including company and proprietors' names, phone numbers, locations, and hours of service, as well as costs, would be extremely appreciated. Now, I know, Dr. Sobota, you've added to the METS list that we've put up on our site. What are some words of wisdom or some advice for these owners and rescue people for disposing of a horse after euthanasia? What are some key ways that they can go about looking for those resources?
I think that's really an important part of your veterinary client-patient relationship. You should be speaking with your veterinarian, trying to plan for this ahead of time a little bit. And that's where we do try to plan ahead a bit. If you see that this may be coming down the pipeline, or you can try to plan for it. And some owners are more proactive than others and trying to think about it and be proactive. And we're in a fortunate circumstance in our area where we have one or two reliable resources, and that's wonderful. But I know there are some deserts out there that may not have as many reliable resources, and we as a veterinary community could certainly probably try to brainstorm more and try to help create better lists. But some of this is also business in the sense of entrepreneurship and who's out there doing this kind of service, and it's certainly not a subsidized service, right? And so this is a business, and certainly having that veterinary client-patient relationship is important. Trying to establish some thoughts beforehand is valuable, but that's not always possible. We know that. And maybe we need to work together as veterinarians to try to continue to compile that list, but there are going to continue to be some deserts out there potentially. And/or you can certainly have a certain amount of money, right, set aside in the sense of, okay, this is going to be X amount of dollars to do this, and trying to plan ahead, right? And that's what happens in the human space a bit. We try to plan ahead for certain things and with end of life, and I think that's going to continue to be an issue, and it'll continue to be a challenge. But there are resources out there, and I think that's important to have that relationship with your veterinarian. Make sure you have some ideas of where to go or what you want to do, whether it's cremation or disposal, or rendering's not really done as much anymore, certainly, but certainly composting and different ideas of composting.
Yeah, I think that it's one point that I've certainly found with our METS owners who are looking at euthanasia. They expect the euthanasia cost, and then the disposal cost is not something that they're prepared for. Which is interesting because it is an extra in the small animal world as well. But I think it's not commonly thought of in the equine industry. Have you found that? How do you deal with that with owners when they are completely, taken out of left field by the fact that they're going to have to pay for disposal as well?
I'll leave that answer up. I'll answer that in a bit.
I guess, I don't think people just really consider it. They don't consider that you now have 1,200 pounds of an animal there. It's not, I don't think it even comes into their mind. We are in one of the deserts that Dr. Sobota was talking about. We have one gentleman who comes out of Delaware who covers the entire most of the Eastern Shore. And that's what he does. You know, his costs go up, fuel costs go up. I mean, the gentleman's available all times of day, weekends. I mean, it's a tough life. And I mean, I don't think I can give quotes. He quotes by the distance he travels from Delaware. And, you know, he's got to make a living too. I empathize with my clients. They can actually get a backhoe, most of them cheaper than they can get the gentleman to come dispose of them. But I don't think people just consider that at all. It just never enters their mind that now they have 1,200 pounds to be disposed of.
I ran across a document that somebody at the equery had compiled, spending a lot of time on the phone with various health departments and animal control and ag extension people for all of the different counties in Maryland. And burial was actually I don't think health departments have particularly signed on to it, but burial was actually the legally recommended solution in a lot of instances. Katy, I can dig that out, and if you want to post that.
Yeah, that would be great. We'll put it on our website and link it when we publish this too. So they were recommending burial even when barbiturates are used?
Yeah, they didn't make a distinction.
Yeah.
Most of the concern was whether it was a infectious or contagious disease that caused the demise in the regulations. The regulations, which were probably quite old, 20 or 30 years old. I tell people that I have not run across anybody that got in trouble with the county government for burying a horse. I'm not saying that it's impossible for that to happen, to be on good terms with your neighbors and don't do it right next to their well. But it has not been a problematical solution other than the logistics of getting somebody to do it.
Dr. Rizzo, good point. I think certainly historically what I've read, 10 feet down and 300 feet from a well was somewhat the recommendation previously. And I do not know anybody who's gotten in trouble for burying their horse on their property. I'm certain that it can happen or could happen. I know the composting individual in our area, to some degree, it's probably similar in price, and she may be a little more expensive than having someone come and backhoe a hole, if you will. So there are some business aspects in the sense of what do you want to do and how much it's going to cost. That's just competitiveness in that space. But certainly all of those things have happened, and certainly it may be less expensive and less of a problem burying a horse than certainly cremation or composting.
I do know. Oh, sorry.
No, I was just saying, certainly it's important to bury or to eliminate that animal, right? Because we are worried about barbiturates, and certainly with wildlife and bald eagles and other animals, certainly there have been deaths, and that is under another purview, federal law. I don't know if any veterinarians have ever gotten in trouble for that as of yet, but certainly that's something we need to be conscientious of as veterinarians, and making sure that animal is eliminated correctly if you do inject a barbiturate.
I do know Delaware, this gentleman that covers Eastern Shore will, I think the cost for removal anywhere in Delaware is $50 or $100, because the Soil Conservation Service in Delaware I'm not sure it's to prevent barbiturates in the soil or not, subsidizes the removal of the horses. So I have clients that literally cross the fence. One's in Delaware, one's in Maryland. Someone pays $340 to have their horse removed, and the other one pays $50. And so that's you know, they could be within a mile of each other. And so that's a huge point over here. Is I have many horse owners asking, how come Maryland can't do something to help subsidize the removal of horses? And as of now, I don't have an answer for them.
The answer is call your representative.
Yeah.
Yeah.
In
We
our
actually-
world, oh, no, sorry, Katie. I was gonna say 30% of pet owners do burial in our space. Obviously, size is a difference, but I think, and I opened my own crematory because it's such a big thing here in South Florida, and we have a big equine community here actually in South Florida, and a lot have called us for cremation, but I do aquamation, so it's alkaline hydrolysis, and our machines are too small, so pigs and goats are as big as we can handle. But I'm amazed there's nobody around here, so it's at all in South Florida, so it would have to be burial. But I think it's hard for those to watch also their horse getting moved after. People don't like we are big about how we handle the pet, and we roll them nicely, we put a little pillow, like it's a whole big experience. And to see a 1,200-pound horse getting pulled onto a truck is shocking. And also, if it does go to a crematory, is that one large enough to handle the pet intact and the horse intact? And there's a lot to that industry that I've learned, that what they have to do if it's not large enough to handle the pet intact. And I always say we gotta be open and honest with families. Like, we can't sugarcoat this, and like, it's not our fault if there's not a crematory nearby to handle something. You know, it's not our fault if there's areas where it's the landfill is what the option is, and it's not our fault. But prepping them in advance is so important, because it is expensive. For us, it's $300 for a cremation, you know, $200 for a cat, let's say. And people are like you said, Dr. Cal, like, they're not ready for that. And it's, you know, they're ready, or Justin, you said that they're ready for the euthanasia, but not for the aftercare. And if they die on their own, this is what I also tell people, what do you do? Because now you've got a Great Dane, and you have to try to bring this Great Dane into a clinic for cremation, and it's hard. So prepping, having all of that information on your website is also really helpful. So that way they've got it available. And when things happen in the bump of the night, they've got contacts. Well, we all know what business to go into.
My lawn is covered with depressed areas where mowing the lawn is bumping over
Yep.
Bill or Max.
Exactly.
And I think, you know, with that, that's another huge reason that METS, we have that money set aside, right? Because so many people, if they come to us, they are looking for euthanasia. They say, you know, I can pay for the euthanasia, but I need help with either finding removal options or paying for it. And so it's, I think, really crucial that programs like METS are able to provide that for people, because it is kind of, I wouldn't say a luxury, but it's certainly a monetary commitment that not everyone's expecting. But shifting gears just a little bit, we have a great question from Christine. She said, considering that most horse owners are aware of and educated about humane euthanasia as a responsible end-of-life option, yet most remain unwilling to choose euthanasia based on their own emotional reluctance, how can our equine veterinarians support welfare by encouraging these owners to choose euthanasia over trying to rehome their aged, ill, or lame horse?
Deep breath.
Yeah.
It's a big question, and I think roundtables like this are a great way to open it up, because I don't think that there is one correct answer. You know, I think it's a lot of kind of introducing this topic and having that conversation over and over again. But I'm not sure if anyone, Dr. Sobota, you seem to be thinking if there's anything that you'd like to share about it.
Well, I think certainly what Dr. Gardner was saying, just about a week early versus 1 day too late, is applicable here, and thinking about the best situation and scenario for the horse at hand, and really trying to guide the owner. You know, it's a difficult question, right? This is where your bedside manner and your willingness to be open about this conversation is important. Yeah, I don't know if I have any tricks. I always tell people I don't think there are any heroes in euthanasia, right? And so within our space, certainly if people want to step away, there are hard parts about the euthanasia process that can be somewhat dramatic, right? Gravity happens, and so horses fall, or we do have to load that horse onto a trailer. And I just always try to tell people there are no heroes in this process, and it's not enjoyable necessarily for us, but if we can relieve that suffering, right, that's a gift. And so that's what we always work towards. And so I think the emphasis of your question was, how do we eliminate maybe some of these horses going to a bad home or a bad situation? Is that correct? And I think that's just, yeah, that's fortunately I feel good that our clientele do think about some of those things, and we have some very caring clientele. That's been very beneficial, but that's not where, you know, that's not every case. And oftentimes I guess we try to work it out, right? You know, you think about and brainstorm about the situation, who can help or not help, and I think that's part of being part of the community. You know, we are all part of this community and trying to figure out people's problems, trying to help them a bit.
I think also, you know, what I'll do is this intractably lame horse or something like that. And I said, you know, what happens if this horse, you sell this horse? I said, it's going to end up, you know, no one's going to buy this horse. It's going to end up on a truck, going to Canada or something like that. Is it really worth your $200 or whatever you're going to get for meat price to do that? And then I also share stories. I had an awful euthanasia years ago that still, it was a donkey that had gone down, and was probably colicky or something like that, but it had melted the snow it was lying in, and then it froze to the ground. So this donkey was still alive, and it was frozen to the ground by its hair. And, you know, I tell people a prey animal like a horse, I think that would be the worst thing that could happen. It can't get up, it can't move, it's frozen to the ground. And I'm like, you don't want that to happen to your horse. You don't want your horse for that to happen. So, you know, you need to think about things ahead of time. It's okay to euthanize them before they get to this point where they're down and frozen to the ground. I mean, it was horrible. It was the worst thing I think I've ever seen. So
I think falling back on the line that euthanasia is not the worst thing that can happen to a horse. It's educational.
Yeah, I think an educational component to that too is one of our supporters Amber talked about how many horse rescues will go to auction and buy horses with the knowledge that they're buying them in order to humanely euthanize them. So I think that what we see with people is a level of unknowing what these horses are going to go through when they're put on the truck, when they're sent to auction, what that fate looks like. Do people put their lame horses on the truck to go to auction so they don't have to deal with it? Probably. But I think it comes back to what you were saying, Dr. Perdue, about, you know, educating, you know, and that's the main reason behind this roundtable, is trying to help people understand euthanasia and that it is not the worst thing that can happen to an animal. The truck is the worst thing that can happen to a horse, right? Like, that is one of the worst things. You know, and we had a couple questions asking about financial assistance too, and METS is here to help with that. We have funds to pay for euthanasia costs and disposal costs, but it's a drop in the bucket. You know, it would be great to have a subsidy program like Delaware has for disposal, for We have to maybe look into that and see if we can't pull something like that up here in Maryland. But it is, I think all of it is based on education and just the public at large having misconceptions about euthanasia, misconceptions about auction, and what it really means to care for an animal for its entire life, you know, even the ugly parts.
So can I ask a question? Forgive my ignorance. So the auction truck is to be sold for meat, usually?
Yeah.
Not always, and sometimes not the first time it goes to auction, but
Older.
frequent flyers that will get bought and then go back to the auction.
Yeah, there's the pipeline. There's auctions up and down the country, and horses will be sent from auction to auction until they sell. Sometimes they put in kill pens, what we call kill pens, and then some horses are eventually bought to be sent across the border to Mexico, Canada. Less so to Canada these days. Their regulations have changed a little bit, so more American horses are going to Mexico than Canada. And then a lot of them get shipped to Japan for slaughter as well.
Okay. Yeah, so I think those that may not be able to afford the euthanasia and the disposal, they feel like that's their only option. My heart goes out to them, because I could not imagine my loved animal knowing that I can't afford any other option but to put him on a truck that's going to be horrible, or you know, not great. So that's sad. There are going to be those that don't believe in euthanasia. So then my point is, well, why are you putting them on a truck? Because clearly that's what's going to happen to them. So that makes no sense. And there are some that don't believe it and they want to keep it. And I've had a lot of that where they're like, you know, are you Christian? And what, you know, death and those questions. And I always say, God gave me the gift to do this. And this is why I'm going to do this. And with a name like Mary, you know, I'm probably been to church once. So, so I try to throw in a little humor every now and then, but for this dark topic. But it is our responsibility. I feel sad for those that can't afford to do it. That breaks my heart. And is there something that we can do? And I think it's really important for the public to know. Oh, this is what I was going to say. I knew there was holding my tongue. It is important that people understand the euthanasia process, because they're scared out of their mind if they've had it done before, or they, you know, whatever. And one thing Justin I like to say is that the anesthesia stops the brain. The brain is what's in charge of the heart and all the other organs. So once the brain is gone, everything else slows down. And because if I just say it stops their heart, we know medically the next up is you know, the brain, then it's all the other things. But people think of heart attacks because they're conscious and their heart stops, and that's painful. So I want them all to know it's unconsciousness happens first. The brain stops first. And owners, so many people don't know that. And so we can educate them on the processes of consciousness. And you can't suffer if you don't know, right? You don't know what's happening when you're under anesthesia for surgery. It's, you know, when you wake up and you got to go through physical therapy and things like that. But suffering takes consciousness. And when we can take that away, we've ended that suffering. And then the biologics happen where breathing slows down, heart stops, and things like that. But I'm shocked at how many people don't know what it is. But you know what? I don't know if before I went to vet school, I knew exactly what it was. So it's, you know, it's okay to have some people that don't understand this process. And I'm really happy that I'm on this, because there's a lot to this world that I don't understand, and it's opened my eyes and of the importance of this. Yeah, Maryland, we got to do something like Delaware. I don't even know if we have that in Florida. Florida needs to get involved.
I get told that every time I euthanize a horse. So how come Delaware? I'm like, oh, I can't help it.
I mean,
I gotta look into Florida now.
It would be so good for the welfare of horses, because people would be less reluctant to euthanize when it's called for.
You're right. And the other thing is that it would be removing the phenobarbital from the ground supply,
Right.
which
Correct.
is until that gets, and I'm sure that's going to come to a point where that will be legislated, and that because it is contaminated, you're finding it now in a lot of sources. So at some point that's going to be legislated, but I do think that having some type of option like that would make a huge difference to people. But in saying that, I also think there are people that honestly feel that this horse that they sell is going to a good home, that there are all these good homes out there that want your horse that can't be ridden or something like that. I don't know whether they honestly believe it or they just think they believe it, but they feel that there's a home for something that can't be ridden and is 25 years old and needs a special diet because they can't afford to feed it.
They're on Denial Island.
Yeah, it's a big island.
I think it tends to be a bit of kind of that blissful ignorance, right? They don't want to accept that. It seems more palatable to think, oh, I can send my beloved horse to find another, person that's going to love them the same way I do, rather than take that step forward and accept that maybe that's not the case and that euthanizing is actually the better gift to that horse, the more humane aspect. And, Dr. Gardner, I think that you bring a lot to the table here as dealing with small animals, because I think on the whole, euthanasia tends to be more widely accepted for the small animals, whereas with the larger equines, we do tend to see a bit of pushback, as we've been talking about. So I'm just kind of wondering if you have any words of wisdom on anything that we can do in the equine world to kind of help decrease that taboo that the small animal industry has done so well at.
I know. This is a fascinating time for me right now. So this has been great. And is it a mixture of the demographics and just the attitude? Because there is more of a use purpose to some horse, to some equine. And my cat. I remember one time I gave a lecture in Texas, and it was Texas veterinarians, and I was doing my quality of life talk, and this gentleman raised his hand. And he's like, "I've been a vet for 50 years, and I just tell people that when they're of no more use, that it's time to euthanize." And so I was like, "I'm glad that's working for you, but my cat's been useless since day one, and I don't like putting her down, right?" So there's been a cat rolling around Justin's office, and I don't think he's very useful. But so
no. He's very useful. He
catches things, the dust mites, the dust balls. So there's a little bit of that. I think this disposal thing, I think, is a massive problem. I really do think this is a big issue. And dare I say, maybe also besides the disposal part, the bigger the animal, the bigger the presence, the bigger the part of somebody's life. Listen, my little cat is just as, takes over my world. But, my Doberman is 110 pounds. And when he died, like, it was such a massive loss of space, loss of presence, loss of, silence was deafening when he was gone. And I wonder if that's, it's a harder loss, maybe. I don't know, because loss is loss, no matter how small, right? But is there just something different? So I think it takes time. Listen, in-home euthanasia for your dog or cat has taken time to become more of the norm, and now it is, and it's just constant education, and veterinarians need not be shy and turn away from this topic. Owners want to talk about it, and I think we're so shy. Even the conversation needs to be trained to the receptionists. When somebody calls in to talk about it, they can't struggle. They have to be confident and compassionate and know the answers and have this discussion, because sometimes they're not going to get to a doctor for this conversation, and it is our frontline staff that needs to have it. So educating them, having education on your website, having talks, like doing public talks about it, and making it not taboo will be massively helpful. But there's still a little taboo in our space too, and it's still there, and just be resilient and keep going, and having conversations like this is helpful.
One of the reasons I love Dr. Mary Gardner is just because we can talk about comparing our industries, right? The horse industry versus small animal. I love comparisons, and I know I just had a chat with her just a couple of days ago about the number of animals we euthanize, and certainly thinking about that, I thought it was interesting. And so I looked back at my records, and we have a 2-doctor practice, thinking about how many horses we euthanized over the last year, and then of course nationally what you've come up with. And I thought that was very interesting, and I'll just share with you, with the crew here, about how many horses we euthanized. So for 2 doctors, we euthanized about 56 horses last year. And so for me, that's a 0.5 animal per week, right? If we want to try to do it that way. And I thought, Mary, Dr. Gardner, what did you say then for the small animal space was?
Okay, yeah. So I teamed up with a data intelligence company. So we pulled data from GP practices across the country. So just all demographics and everything. And on average, a full-time veterinarian will have an active client base of about 1,000 pets, and they will. So that might be different too, right?
Yeah.
And they will euthanize GP doctors 1 pet a week on average. ER is about triple that for obvious reasons. So so us veterinarians need to know that we will probably euthanize 50 pets per year. It's about 10% of the small animal pet population. So 10% will die every year. Weird that I know these numbers, a little creepy. It's always fun to go to dinner with me, but I have to know it for both lap of love and also for my crematory. How much, do I need to be prepared for in this space in our demographical region? So it's interesting. A half of a pet for a week for you. So
Yeah,
2 a month, let's say.
Yeah.
And how many active clients or patients do you have? Is my next question later on that you can go look at, right?
Yeah, I need to check that number, because of course
be.
that's going to change every year. It's going to change every year, but I need to look at that number. It's a good number.
I would
gonna
say
ask,
our numbers are about the same, Justin. I'm just thinking we as far as large animals, we're probably a 1.5 doctor large animal and 5 doctor small animal. And I would say probably, we would be about the same for horses, and small animals probably, I would say, again with Mary, like 300 a year between 5 doctors. So that's about the same numbers.
Okay.
I think that's
Yeah,
helpful too for veterinarians when we're stressed about doing euthanasias and stuff. Like it's
Yeah.
be ready. Also in vet school, it's 1 a week, like, which could be shocking to new veterinarians. Like that may seem a lot, and when you're like us doing 4 a day, it's a little bit different. But so on average, it's one a week.
Dr. Radu, do you have any off the ideas about what your rates are at Damascus Equine? Are they similar, do you think?
Yeah, I'd have to go back to pull them up. I just added one to mine this morning. So I'm 1 a day starting today.
It's interesting that the rates are kind of similar. That there's some consistency there, and I'm not sure really exactly what that means, but it's interesting that it's consistent across the practices there.
And what I also think too is it means we need to be good at it. Like this is not a one-off thing. This is, if you're going to be doing 1 or 2 somethings a week, you need to be good at it. If I'm going to do a certain surgery once a week, I should be good at it. And that's where, when I lecture to veterinarians, I'm always, hospice, geriatric euthanasia, and I want them to be really good at it. And I hope that at the equine conferences that this is also a topic that's talked about, and end of life care and caring for the pet, caregiver fatigue and all these things, because it is just as important of a procedure as, I was trying to think of an equine procedure. I was going to say TPLO, but that's my world. So
Now, Mary, I also want to compare something else with you. Certainly, in a more recent study that I just was reading this morning about the most frequent health reasons for euthanasia in the horse population, one is, it said something about 25% is laminitis related consequences. 2, we're at colic about 21%. Non-laminitic lameness is about 20%, and age-related deterioration, etc., quality of life is about 20%. And so, I think certainly when we're thinking about these quality of life scales and so forth, for me, it's about colic or lameness or laminitis, right? Laminitis, colic. And so those are the top 2, but certainly there are other things that are very important. In small animal space, top 1, 2, 3.
This is a great question. I always thought, by the way, I'd be like the cat whisperer because I'm going to homes and, cats don't like to travel. And so it's dogs, large dogs with mobility issues. #1, hands down issue. And that might be the small, my in-home space, because they can't get to a clinic, and I've got to get there. But even when I was in GP, I think anecdotally, it was mobility issues. For whatever reason, everybody assumes it's arthritis, but there's sarcopenia, there's degenerative changes. My dog had cancer in her spine. And like I said, sadly, 50% of pets are not seen during their geriatric phase. So sometimes the diagnosis isn't done. And so we're dealing with symptoms. So it's mobility is the symptom for whatever the cause. And up next is cancer.
Okay. Yeah. So I guess in our equine space, we're talking maybe about 45% then for mobility, laminitis and lameness together. So we're talking 45%.
Yes. I'll get you my stat on my mobility. It's just as probably high, 30% probably at least. Kitty cats, we see 30% cats, and usually people don't. It's kidney failure or cancer in kitty cats. But so I'm going to stick with dogs just because slightly closer in size. Mobility is number one, and that's where becoming, dare I say, an expert at helping a family set up their home to manage a mobility pet is important. And same thing I think with a barn, and making sure that they've got ease of access to things and safety and things like that. I think it's just as important. Okay, I'm ready for a horse. I got some people I can call if I need help though, because I don't know a darn thing about horse.
Justin, I'd have to say that catastrophic orthopedic injuries is that's a pretty significant percentage. Maybe that's on my mind because that's what I saw this morning. But
okay.
And so he brings up a good question, like it's the catastrophic or the emergent things, and I think sometimes those are easier to euthanize because it's like we have no option and this is it. That can be hard because owners aren't prepared. It's the long-term chronic slow, what I call the slow declines, that man, those are hard and for owners to go through and know when to say goodbye. And so,
especially when they're seeing the pet every day, and if it's a slow decline, you don't see a month apart.
Yep.
And I think that happens in horses as well.
So for you guys, I would say take video, and I say this in my small animal, take videos and pictures to show the difference of how they, what their stride looked like a month or two before versus now. And you could see the difference. Like if I looked at a picture from our vet school days, I'd wonder where my 25 pounds came from and why, like, all of a sudden it just appeared, but it didn't. It's slow. And so watching pictures and Dr. Cowan just got my joke, but it was helpful for me and my own dog is to watch a video from just 1 year ago. And I'm like, ooh, it takes your denial goggles off a little bit is to see those videos. And so I think it's super helpful for those slow declines, not the catastrophic cliff, but the slow declines.
I did a similar thing for my dog. We lost one of my dogs to lymphoma a few months ago, and it was the same kind of thing. I took a video a couple months previously, and then we compared it to his present movement, and it was, I mean, for me, it had been a no-brainer already, but I had to convince others in my family, and it was a really useful tool in showing like this is 100%. A legitimate decline. It's time, so that is a really interesting thing. Or even just to, even if as vets you don't take the video, to suggest that owners take a video.
That's what I do.
Every week. Yeah, just like on a Monday morning at 8 a.m. you take a video.
You know what, that's also very helpful. Okay, I'm sorry, I feel like I'm totally taking over. But what's also helpful with that is afterwards and deal with their grief. And I know there's a lot of questions on grief too. It's very helpful for sometimes owners to look back and reflect, to be like, you know what, I did make the good decision. That's why, Justin, too, those quality of life skills are so good, where you could, once the veil of grief is through, then you could say, you know what, he was at a 2 and he should have been at a 9. And now, because I could, grief is one thing, regret is quite another. And if we can remove regret from people, they will grieve better and maybe get another horse one day sooner than later, right? And so those videos, those pictures, those scales are so good even after the fact to help them get through that time. And, for me, it took a week for me to post anything about my girl Sam, because she's quite famous on my Instagram. And now I had to let everybody know that she's an angel now. And it was not, but what helped me get through the duality of a broken heart and a heart that knows she's okay, because you're in that space of like, and everyone's, oh, she's okay now. And I just, you know, I want to kick them because like, I still would like her, is to see those pictures of Sam when she was Sam, you know, when she was enjoying her joys of life. And that's what you have to reflect on. And so there's a wonderful, you know, magic to having that available to families.
I like that. No, I mean, certainly we tell people, okay, send a video or send a picture once a week or every month or so and let us know how that patient is progressing. And I think with technology now you can do that so easily. And then I like the thought of, okay, post euthanasia, we can still reflect, and certainly we all do, right, on our own families, et cetera, right? So it's an important aspect. I like that.
I could listen to you all day, Dr. Gardner.
Yeah, I gotta try to be quiet.
No, it's just it's inspiring. So
oh,
it's inspiring.
Weirdly, I love this topic. You know, because I think it is has been so taboo, and like I said from the beginning, we can make it good. You know, even, and you know, there's a lot of, here I go. There's so much study on grief and helping families grieve, and also that if you're able to say I love you to a human before they die, you will grieve faster. Is proven. So to me, the same thing for my pets. Every day I'm like, I love you, I'm loving you, I love you. And so for those horses too that are nearing the end, if they could say I love you every day, so that way when they do die, they're not like, I didn't say it enough. And you know, at a euthanasia, I don't want people to say I'm sorry. I want them to say thank you, right? Like that's what I want. And if we can remove that and prepare them and help them, like what a great honor it is to help people through this end of life.
Yeah.
Something I try to think about, and I certainly think about afterlife as well sometimes, and thinking about situations. I think it's important after euthanasia that somebody be with that animal, right? Because the brain is still active, right, for a short period of time, and so I say certain things, right, to that animal because I want them to feel like, hey, they are loved, and thinking about the consciousness of the brain, even though the heart is stopped potentially, right? The brain is still active, even though it's in a slow decay, if you will. But yeah, I think that period post euthanasia, if you will, is vitally important, and I guess I talk to the clients about that as well, and I think that can provide some relief or some good feelings as well, knowing that they were there, right, there for that time period.
Oh my gosh. First off, hearing is the last sense to go. So I always say talk throughout the process, which is one beautiful thing with us with the anesthetic, you know, sedation, is that they could be close and talking and things like that. So I understand. Lead shank, I'm going to grab that, or I'm not going to grab that. But you know, death is a process. You know, it's a phase. It's not a moment and a quick moment. And I think in small animals, one thing that we do bad in clinics is we make it fast, and we're like, boom, done, and now let me, you know, process their body and, you know, put them in a cadaver bag and, you know, and move on. And like owners need time. And if they don't, that's okay too. Like it's okay if they're like done and they want to walk away because they've been grieving. But it's also okay to spend an hour laying there with them. Like there's nothing wrong with that. And I've helped owners that say, can I keep them overnight? Absolutely. Let me tell you how to do that. You know, things may smell a little bit, but that's okay. Let me help you through that. And so many people are taboo about that, and Buddhists keep them out. I learned that a lot in California. I had a lot of Buddhists, and I learned what you know, different cultures want. And if I can make that better, then why not? Like, who am I to say that you can't, you know, love on your pet for an hour after they've gone? Sam was getting a ton of kisses for like all night. Call me crazy.
Yeah.
I've done both. I've done with my small animals, I've done clinic and in-home, and the in-homes were, I'm sorry, my puppy is barking. The in-homes were so much more healing.
Yes.
Because I didn't feel rushed, and because I was able to take the time that I needed, even though the vet stayed there with us. She was non-intrusive, and she just let us do our thing. And I've been to equine euthanasias too, and the vets that I've dealt with for that have done the same thing, you know, taking obviously the precautions that we need to for human safety, but allowing owners to, in the post-euthanasia, say things to their animals. It's good for the animals, but it's so important for the owners and for the people who love those animals. It's so important to allow that space. Grief, generally speaking, is not something that we talk about in our culture. It's in Western American culture.
It's just a horse, guys. Why would you grieve over just a horse?
Right. I mean, even in humans, grief is not something that we prepare each other for. So it's to be able to extend that time to an owner and to understand how valuable it is. I think that's such an awesome thing that you guys do, to allow people that brief moment to begin the healing. That's when the healing begins, I think.
Well, the anxiety's gone.
Yeah.
Because there's a lot of anxiety up to it. I call it there's anticipatory grief. I call it anticipatory death, because they're waiting. Tomorrow I'm going to do it. At 4 o'clock I'm going to do it. Dr. Sobota's coming in 2 hours, in 1 hour, in 30 minutes, and it's not easy. And once you do it, that anxiety goes away. It fills in with grief. It makes room for sadness and things like that. And there is the moment of he's okay now, and I get that. But that does not replace the grief they will have. And whatever space somebody needs to go through, just let them go through it.
I think for a lot of caretakers, one of the aspects is that they've been spending, X number of hours with extra care with their animals. And once the animal's gone, there's this big hole in their day.
Yeah. Yeah, Dr. Radu.
They don't have anything to replace it.
Yep. Listen, I have an extra 2 hours at least every day right now. Like in my morning, and I'm not ready to replace it with anything else just yet. But you're right. And it's also a purpose that they've had, and sometimes now they've lost their purpose. And so it's interesting.
What I love what we've done already, and this is what I always think and I see as a progression of these kind of talks. We started with, all right, what are the ways to euthanize a horse, right? What are the AEP guidelines? What's the science behind this? But where have we progressed? We've progressed to the emotional intelligence and the feeling of euthanasia, right? We're all scientists, if you will, veterinarians here on this call, but we've all progressed. And I think that's what Dr. Gardner has done in her space in the small animals, really brought an understanding to us as veterinarians, right? The human intelligence aspect of this and the emotional intelligence of what we're trying to do, and that all the science is important, but getting to this point of talking and communicating is so valuable, and I feel like sometimes maybe we don't do that as well in our equine or large animal world, even as veterinarians, right? We don't go to a CE and think about, I want to hear about euthanasia for the next hour or two as a CE. No, we've never done that. In your space, you do that
all day.
Right, exactly. So do we want to do that as part of more of our CE, to talk about some of these emotional?
And I think, Justin, that you're right, but I think what's happened is that, again, our profession is changing, and, it was at one point a livestock profession, and now it's become a people profession. And so, we need to start thinking about, that most of the, we're not just treating the draft horses that was pulling the milk wagon anymore. We're transitioning to the point where horses, a lot of them are companion animals, and we need to, think more about that versus the strictly performance athlete that, is replaceable, just like the car. You keep it tuned up and lubricated and ready to go, but these are now turning into dogs and cats. And I think society's views on animals as far as livestock has changed as well. And I think that's one thing, you're right, we need to be more aware of that.
That's an excellent point, Dr. Callahan, that there's an ongoing shift of the horse away from use to as companion. And I think that's, I think that maybe that's kind of what happened in the small animal world, 10, 15 years ago. And that helped destroy some of the taboo around euthanasia. So hopefully that will assist the equine industry in that too. That's a really good point. Is there anything that you four wish your clients or people at large knew about euthanasia? Is it okay? one specific question is like a subtopic to that. Is it okay to give a horse their favorite treats or like a last meal right before euthanasia? Is there anything else that you wish people would know when you go to their farm to perform this procedure?
Well, yeah, certainly. I'm for the most part in favor of treats or a carrot or a mint or something of that nature right before euthanasia. And of course, it's all situational, but I'm always in favor of that. I'll let the others speak, and then I have something else to say.
I'm yeah, whatever the horse's favorite treats are, they can feed it up to the time that we tranquilize the horse. The one thing, if I had to choose, is that you need plenty of space. There are a number of times where I've been asked to euthanize horses between bramble bushes and the hole they've dug, and it's not always well directed, and I'd much rather have more space. It's much safer for me. It's much safer for the horse. It's much safer for the handler to have a larger area in which to euthanize, because sometimes you're put into situations that are not safe, and I appreciate the fact that they have only this small area to bury the horse, but it's not necessarily always the safest for the people doing the euthanasia.
I had one memorable one where the people had the hole all dug, and I sedated the pony, and I advised him not to get too close to the hole, and went back to the truck to get the pentabarb solution, and they were concerned that it was going to be hard to drag the pony into the hole once it was euthanized, so they wanted to get it right next to the hole. And when I get back from the truck, everybody's kind of standing around looking down into the hole, and there's no pony to be seen.
Oh my gosh.
I had to crawl down into the hole and euthanize the sedated pony.
Yeah, I've been there too.
See, you guys have, there's a huge difference, obviously, because of this, and in the small animal space, if they're eating, absolutely. There's my girl having her Valentine cupcakes on her last day, and she had banana pancakes, she had everything. But for me, it is the experience, and that's for us. It's, I don't care what music they want to have. If they want to be alone, or do they want to have a party? Do they want, like, I'm ready for anything. But for you guys, because of that, the danger part of it and the safety part of it, it might even be more important to heighten the before and the after, and making sure that we, support them better before, because there is that moment they need to step away and be safe, and it's not going to be pretty, and everybody needs to be safe. And yeah, Dr. Callahan, I haven't been in a bramble bush and a hole, but I've been under beds and like up a fireplace trying to chase a cat. So sometimes it's not always easy, and we try to make our best. And I think if we prep the owners early too, that way they don't get mad at us, because sometimes their anger and grief comes out at us because it wasn't done perfectly, or what do they expect? And I wish also people knew that this is still life and death, and it's not always perfect. Pet dogs and cats don't curl up in the middle of the night and just pass perfectly and everything is great. And same thing with horses probably. And we will do our darndest to make it as good as possible. But sometimes there are reactions, and sometimes there are, for us it's a bark or a yip when we give our sedation, and they're in pain, and I just gave them a shot. Like, this is what's going to happen, and we get battered a little bit on that. And so I wish that we can all know that we're doing our best, and we're going to all try to do it our best. And for you guys, this is, one day I want to go to Maryland and go on a few calls and I'll stay out of the way.
One thing that was pointed out to me by a client was letting the pasture mate see the dead animal and even go over and sniff it. That there's much, on some level, there's recognition of death and acceptance of it, much more so than if their pasture mate had just been led away and disappeared, that they would be still frantically calling for them.
Right.
I've had some horses that seem to care, and some horses that don't seem to care. That You know, the owner will lead them over and the horse is totally disinterested and wants to graze, and others that are grieving. So I think that it's fine if owners want to let that happen, but they don't always react in the way the owners think they will.
Yeah, I've had a dog just like walk over his buddy, like just getting to the food bowl, and it's just like humans. My better half has had no emotion over Sam, not cried, nothing, and I'm like a hot mess every day crying over something. So like we're all so different, and so are the pets. And I wonder, it's interesting because there's been studies in dogs about grief of a housemate. I was gonna say littermate, but a housemate. But very interesting about horses. It would be interesting to know if they are like pasture mates, and they're I feel like they're so bonded to each other a little bit more sometimes.
There was a post from a local rescue, and Emily, I don't remember the rescue name. They posted this really great picture of a herd mate that had been euthanized, and she came in with another mare, and the mare was standing right over, and I don't think she moved for about 3 hours. And the rest of the herd, who were relatively new to these two, formed like a semicircle around her and just stood there for a couple hours. It was really moving and really beautiful. And I think that it's not all horses are going to do that, like you said, Dr. Callahan, but I think it's a matter of managing the expectations of the human, right? They may want to see their other horses, their other herd expressing their grief that way, and not all of them will. Same with my dog. One of my dogs was sad for weeks after I had to put one down, and the other, my second in-home euthanasia, the other one was like, oh, whatever, where's my bowl? So they're like humans. They grieve in different ways, but managing those expectations and providing that opportunity for them, I think, is the most important part of that.
Goes to show you how sentient, like these are sentient beings. Like to know that they do that, like it's just phenomenal and amazing. I want to see that picture.
I think that is one of my more often asked questions. If we were to calculate the number of questions from our clients, I think that is one of our bigger questions, is that, oh, can his herd mate come over and find closure with XYZ? And I think that's really important. We try to do that, and I think it's a valuable thing. So yeah, it's an important question for me. And sometimes I was thinking earlier just about the fact that what do people need to know before euthanasia in horses? I had someone tell me this last year, and I thought it was valuable. Is that horses don't eat because they're comfortable. Horses eat to be comfortable, if you will. And so, sometimes you have these tough, difficult colics, and you get them feeling better with certain, NSAIDs, et cetera, right? And so we get them feeling better, and then they want to eat. It's not because they're always comfortable necessarily, but it's to be comfortable. I don't know if it's necessarily the same in small animal, but I think about that, and I try sometimes to relay that to people, because they're like, oh, my horse is eating now. And I'm like, well, that's not always the best thing, or that's not always an indication that the animal is well.
There's a great saying in human hospice that the food and water are for the living, and the body won't eat or drink for a future it knows it doesn't have. And I say that a lot to my end stage, patient, like the families of the end stage patients, because they're chasing the cat around with a tuna fish and and the cat now has anticipatory, reactions to the family coming out. They just want to lay in a sunbeam and be left alone. And the body is going through its process, and it happens in humans too, that they slowly need the less requirements and the desire for food or water, and sometimes giving them that actually makes them worse in the human space. So
yeah,
all interesting.
Well, we only have about 10 more minutes left in our kind of scheduled time, but if anyone has any closure comments, I think that would be great. I mean, we've definitely kind of spanned as much as we can within this 2 hours. I think this topic is something all of us could go on and on about for days on end, because there's not like a black and white option. It's not usually linear. It's all very unique to each individual. And I think that goes for equine and small animals as well. So
the only thing I'd like to bring up is grief. And I know Dr. Gardner had brought it up briefly that there are resources available for grief. I think people don't know where to look, and I honestly refer them to Dr. Gardner's website.
Thank you. Thank you. I was gonna say we do have a counselor on staff actually, and people could call. Does not have to be a lap of love person or client. So thank you, because they need it.
There's also a Facebook group that's kind of a spinoff of Horseback Corner, which is a pretty popular Facebook group. Dr. Gardner, there's a pet one too.
Yeah.
But it's a specific group for owners who have lost their horses. And that seems to be a pretty good resource as well.
That's great. Yeah, only 20% of small animals, see, I know all these weird stats. 20% of small animal practices give information about grief to families. And not everybody will need it. Not everybody's going to need, that, but they ask about these things. Justin, right? That's your number one question is like, what about give them information for their own grief, for other pets. We give a booklet out at every euthanasia that talks about housemates and, ways to honor their pet and things like that. And have that on your website and have that available, because those that need it are searching for it and they're too shy to ask. Maybe they don't want to be the ridiculous one that's been, grieving for a month over their horse. There's nothing wrong with that. You loved your horse.
Yeah, I think sometimes there's a guilt about grieving for animals that feel like it's inappropriate.
Yep. And it's not inappropriate. It's totally healthy. See, Justin, your cat's still useless.
Just sitting there.
Not even a sunbeam.
If I was that Texas vet, it would be time.
I just think it's a lot of fun to have this discussion with all of you, because everyone does bring a different perspective, and I think that's the value of our conversation today. So I just want to thank all of you guys for participating. This is great.
Yeah, sorry, my dog. I second that. This has surpassed my hopes, and I can't wait to get this out to the public and hopefully, just make a little bit more of a shift in the conversation and make it more less of a frightening thing for people. I'm going to mute now because my dog is barking.
Well, thank you guys for having me. I'm humbled to be here, and hope I gave some good advice or just a perspective. And I'm so open to learning so much. My favorite rotations in vet school was actually my equine rotations, and it was just, there's nothing as amazing as being in a barn and just hearing them, and I just loved it. I wish I was born and raised in that world, because it would have been easier for me to be a part of it. So it's been really fun to be here to talk about such an important topic. So thank you guys.
Yeah,
Thank you for your, thank you.
You all brought so much to the table, and Katy and I think we try so hard with METS to open up this conversation, but we're just horse people. We don't have a degree in veterinary medicine, and so there's so much value to just opening it up to you guys, having everyone's different points of view. So we really thank you for your time and all that you could bring to the conversation.
Well, thank you for putting it all together.
Yeah,
Yes.
Thank you.
Yes, thank you.
Thank you so much. And maybe we'll do another one of these. So watch for emails from me.
Awesome.
All right.
Thank you guys.
Thank you guys. Have a
so
nice
much.
day.
Yeah,
Enjoy
bye.
the lovely weather outside.
Yes.
Bye-bye.
Bye.
See you.
Bye.
Thank you.
Thank you. I think he just muted again, didn't actually.
I'm just gonna remove.
There he goes.
I put him in the waiting room.
Okay. He did that last time too.
Yeah, I just put him in the waiting room.
You wanna
I'm
stop
also gonna stop recording now. Stop cloud recording.